Welcome back to Step 1 Network and the third in our series talking about bloodborne infections. Today I'm going to be talking about HIV. So HIV stands for Human Immunodeficiency Virus. That is, the virus that attacks and weakens the immune system in people. If left untreated, that can go on to cause very serious life-threatening infections, and that final stage is called AIDS, or Acquired Immunodeficiency Syndrome. Around the world, there are about 36 million people living with HIV, but 1 in 10 of them are children, and about 25 million people have already died from this infection. In Canada, about 75,000 people are living with HIV, although 1 in 5 likely don't know that they are infected. About 10% of people in Canada with HIV are Indigenous. HIV gets into the body and attacks the immune system. This can be super complicated and technical, so I'll just try and give a really brief summary. HIV specifically attaches to and then takes over and destroys cells in the immune system that have the CD4 marker on their surface. This is especially true for cells called T helper cells. Now, those cells are like the control mechanism of the immune system, and so as they get destroyed, it's harder and harder for the body to fight off infection. When someone is first infected, many of them will have an initial or acute infection 2 to 4 weeks after becoming infected. Now, this can seem like just a general flu-like illness with fever and chills, often a rash, sometimes swollen lymph nodes or sores in the mouth or the genitals. This can last for a couple of weeks, but because it tends to go away, often people don't realize that it could be related to HIV, and so they don't seek out the appropriate testing or treatment. During that stage, however, the virus levels are actually super high in the body, and so the chance of spreading it on to others can be quite high. After that initial infection, people will move on to the latent phase, meaning inactive. So most people feel totally fine and don't realize that they still have HIV in their systems. Over the years, about half will eventually develop swollen lymph nodes in the body that can last for 6 months or more, but otherwise will feel fine. This stage can last for 2 to 20 years, on average about 8 years without treatment. And during that time, the immune system is slowly being attacked. So those CD4 cells that I talked about, when you do a blood test, the normal level in a healthy adult is around 500 to 1200. As the HIV virus is slowly destroying and attacking those cells, that number drops and drops over the years. Once that drops below 500, someone's risk of picking up different infections climbs. And once it drops below 200, that is when you meet the diagnostic criteria for that final stage called AIDS. That, like I said, can take many years of that level slowly dropping while the virus level slowly climbs, as you can see on this graph here. That final stage, or AIDS, is defined as a person with HIV with a CD4 count under 200 and or various serious opportunistic infections. So that means infections caused by different things, funguses, parasites, viruses, that can cause really serious infections, including in the lungs, the brain, or elsewhere in the body, that someone with a healthy immune system should typically be able to fight off, or serious or recurrent bacterial infections like pneumonias or TB, as well as various cancers. That final stage of AIDS, without treatment, typically has a life expectancy of 6 months to 3 years. The good news really is that there have been amazing strides made in terms of the treatment for HIV/AIDS in the last couple of decades. So if someone is diagnosed early on and started on the appropriate treatment and continues to take that treatment every day, their life expectancy is essentially normal. In terms of transmission then, how is HIV spread? It is spread through blood and various bodily fluids. So those include semen, including pre-ejaculate, vaginal and rectal fluids, and breast milk. That can happen through direct blood-to-blood contact, or if one of those fluids gets into a person's body. So that can be through the wet or mucous membranes, the linings of the mouth, genital or anal tracts, especially if there are tears or if there are sores because of different STDs, or through dry skin if there are cuts or sores. It is not spread through intact, regular skin, and it's not spread through saliva or tears, and so it is not spread through casual contact. The main risk factors, like I said, then are through blood and bodily fluids, specifically through sex and through needle use. Around the world, mother-to-child transmission is another huge risk factor. However, with early diagnosis and treatment, the chances drop to below 1%, and this is why pregnant people in Canada are strongly encouraged to be tested so that if necessary, they can get on treatment and protect the baby. Now, the number one risk factor, like I said, is through sex. This can include vaginal, anal, or oral sex, or even the sharing of sex toys. Certain sexual acts are at higher risk, and this is especially true if someone has STDs causing sores or other ulcers that can make it easier for HIV to spread from one person to another. In North America, HIV has been stereotypically associated with men who have sex with men. And while that community does have higher rates, around the world and even in certain parts of Canada, heterosexual sex is actually the highest risk of transmission. Certain sexual acts are at higher risk for picking up HIV. The highest risk for picking up HIV is being the person receiving anal sex. There are some links down in the notes to a few different websites that can go over the different sexual acts and what the risks are with those, so you can know your risk and how to best protect yourself. In terms of protecting yourself, the best way to do this is to use barrier methods, so condoms or other barriers with all sex acts if you're having sex with someone whose status you don't know, with a new partner, or with multiple partners. If you are someone who is in a high-risk group, you might qualify for pre-exposure prophylaxis, which is medication that you go on when you're negative to try and prevent you from picking up HIV. The second risk factor is in terms of needle use. This especially applies to injection drug use or other drug use through injections, even things like steroids, stuff like that. Protect yourself by never sharing needles or any other drug use equipment and using everything clean every time. Historically, HIV has been associated with blood transfusions. However, in Canada, blood has been tested for HIV since 1985, so the risk now is essentially zero. There have been some cases of HIV spread through needle stick, especially in medical setting, although there's a possible risk in the home setting as well. So if you're using needles, clean them up so others can't accidentally stick themselves. We encourage anyone with any risk factors to be tested at least once, and if you continue to have some ongoing risk factors for picking up HIV, you should be tested on a regular basis, because we know that if we detect that virus early and help you get on treatment, that can have amazing effects in terms of helping you stay healthy, protect yourself and others. I'll be doing another video talking about the different testing that is available. Thanks for watching. Check out our Facebook page for more information, or if you have any questions. Thanks. Bye.